There is a lot of talk about reopening society a little bit quicker due to more people being vaccinated and the case numbers declining. Taken to Instagram, Leo Varadkar said that the potential reopening of gyms will be on the agenda during next week's cabinet meeting. He says he misses the gym and he is sick of running around a park. Which got us talking and saying, you know, we all are still remembering, or perhaps we should be remembering, what happened in December when we reopened, that spike in cases in January. We've had lots of stops and starts with the vaccine schedule, and we're now talking about, despite those stops and starts, reopening in an accelerated fashion. How do you feel about it when you hear all that stuff?
I feel a little bit nervous. I think we need to be cautious about this. And I have to say, I thought it was an odd thing for the Tánaiste to say. Now, look, it could have been a throwaway comment, so I'm not going to be too critical, but you know, like, sick to death of running around a park, that's not the basis on which we should be making decisions. I'm not sure we're at the point yet where we're ready to reopen wet pubs. I think restrictions should be eased, but I think it should be done carefully, and I think the government needs to show leadership. Last Christmas we had a lot of that. Oh, look, if we don't allow
a meaningful Christmas,
if we don't allow a meaningful Christmas, people are going to do it anyway, and look where that led us. So let's make decisions, and I think I'm not saying we shouldn't reopen, but let's do it cautiously, and let's do it for the right reasons, and let the government show leadership on this.
I think we can ease restrictions, Shane, but I think we can only do them if we do two of the following things. Is one is very likely if we lower the age at which we're willing to give the vector vaccines, by which I mean AstraZeneca or the Janssen vaccine. If we lower that from the 60 down to near the 30, then that will help us do this. I also think that there's a good argument for lengthening the interval for vaccines, rather, like the Pfizer vaccine. If we were to do those two things, if we were to lower the age and lengthen the interval so that the vaccine schedule can be accelerated, then I think we can ease restrictions.